We decided to do our group project on diabetes mellitus. Diabetes is characterized by hyperglycemia or high blood glucose, resulting from the body's inability to use the sugar from food eaten for energy. It is a systemic disease that can affect the body on both immediate and long-term basis. The most prevalent acute complication is hypoglycemia or low blood glucose. Hypoglycemia is a potentially life-threatening condition requiring immediate and appropriate treatment. When blood glucose levels are persistently high, a wide range of chronic complications can occur. These can include kidney disease, vision loss, heart disease, stroke, and neuropathy, among others. Etiology. Diabetes is a chronic disease that occurs because the body is unable to use blood sugar properly. The exact cause of this malfunction is unknown, but genetic and environmental factors play a part. Risk factors for diabetes include obesity and high levels of cholesterol. What causes diabetes type 1? Type 1 diabetes occurs when the body does not produce insulin. This form usually occurs in children and young adults and requires insulin injections. The exact cause of type 1 diabetes is unknown. Usually, the body's own immune system, which normally fights harmful bacteria and viruses, mistakenly destroys the insulin-producing islet cells in the pancreas.
What causes type 2 diabetes? Type 2 diabetes occurs due to insulin resistance combined with insulin deficiency. This form is usually associated with older age, obesity, family history, high blood pressure, hyperlipidemia, and coronary artery disease. Type 2 can generally be controlled with diet, exercise, and oral drugs. Type 2 diabetes is the most common form of diabetes. It is caused by several factors, including lifestyle factors and genes. You are more likely to develop type 2 diabetes if you are not physically active and are overweight or obese. Extra weight sometimes causes insulin resistance and is common in people with type 2 diabetes. The location of body fat also makes a difference. Extra belly fat is linked to insulin resistance, type 2 diabetes, and heart and blood vessel disease. A good way to see if your weight puts you at risk for type 2 diabetes is to check out a BMI, body mass index chart. Genes and family history. As in type 1 diabetes, certain genes may make you more likely to develop type 2 diabetes. The disease tends to run in the families and occurs more often in these racial or ethnic groups: African Americans, Alaska Natives, American Indians, Asian Americans, Hispanics and Latinos, Native Hawaiians, and Pacific Islanders. Genes also can increase the risk of type 2 diabetes by increasing a person's tendency to become overweight or obese.
What causes gestational diabetes? Scientists believe gestational diabetes, a type of diabetes that develops during pregnancy, is caused by the hormonal changes of pregnancy along with genetic and lifestyle factors. As with type 2 diabetes, extra weight is linked to gestational diabetes. Women who are overweight or obese may already have insulin resistance when they become pregnant. Gaining too much weight during pregnancy may also be a factor. Genes and family history. Having a family history of diabetes makes it more likely that a woman will develop gestational diabetes, which suggests that genes play a role. What else can cause diabetes? Genetic mutations, other diseases, and damage to the pancreas and certain medicines may also cause diabetes. Cystic fibrosis produces thick mucus that causes scarring in the pancreas. This scarring can prevent the pancreas from making enough insulin. Hemochromatosis causes the body to store too much iron. If the disease is not treated, iron can build up and damage the pancreas and other organs. Hormonal diseases. Some hormonal diseases cause the body to produce too much of certain hormones, which sometimes cause insulin resistance and diabetes. Some of these diseases are Cushing's syndrome, which occurs when the body produces too much cortisol, often called the stress hormone. Acromegaly occurs when the body produces too much growth hormone. And hyperthyroidism, which occurs when the thyroid gland produces too much thyroid hormone. Damage to or removal of the pancreas can also cause diabetes. Pancreatitis, pancreatic cancer, and trauma can all harm the beta cells or make them less able to produce insulin, resulting in diabetes. If the damaged pancreas is removed, diabetes will occur due to the loss of the beta cells. Some medicines can also cause diabetes and harm beta cells or disrupt the way insulin works. These include niacin, certain types of diuretics, anti-seizure drugs, psychiatric drugs, drugs to treat HIV, glucocorticoids, medicines used to treat inflammatory illnesses such as rheumatoid arthritis, asthma, lupus, and ulcerative colitis, and also anti-rejection medicines used to help stop the body from rejecting a transplanted organ.
Clinical pathology. The role of insulin and glucose in the body. Insulin is a hormone that comes from the pancreas. The pancreas secretes insulin into the bloodstream. Insulin circulates, enabling sugar to enter cells. Insulin lowers the amount of sugars in the bloodstream. Blood sugar levels drop, and so does the secretion of insulin from the pancreas. Glucose, which is a sugar, is the main source of energy for cells that make up muscles and other tissues. Glucose comes from the food and liver. Sugar absorbed in the bloodstream enters cells with the help of insulin. The liver stores and makes glucose. When glucose levels are too low or you haven't eaten in a while, the liver breaks down stored glycogen into glucose to keep your glucose level within a normal range. Type 1 diabetes. Insulin production is absent because of autoimmune pancreatic B cell destruction, which produce insulin, possibly triggered by an environmental exposure in genetically susceptible people. Antibodies are produced that attack and damage B cells in the pancreas that are responsible for producing insulin. Type 1 diabetes occurs when your immune system, the body's system for fighting infection, attacks and destroys the insulin-producing beta cells of the pancreas. Scientists think type 1 diabetes is caused by genes and environmental factors such as viruses that might trigger the disease. Type 2 diabetes. Type 2 diabetes usually begins with insulin resistance, a condition in which muscle, liver, and fat cells do not use insulin well. As a result, your body needs more insulin to help glucose enter cells. Often insulin levels are very high, especially early on in the disease, but peripheral insulin resistance and increased hepatic production of glucose make insulin levels inadequate to normalize plasma glucose levels. Insulin production then falls, further exacerbating hyperglycemia. Possible causes are genetic pancreatic diseases, surgical removal of the pancreas, tumors in endocrine organs, corticosteroid use in the treatment of asthma and arthritis, or niacin for treatment of high cholesterol. Gestational. Hormones produced by the placenta contribute to insulin resistance, which occurs in all women during late pregnancy. Most pregnant women can produce enough insulin to overcome insulin resistance, but some cannot. Gestational diabetes occurs when the pancreas cannot make enough insulin.
Client factors and performance skills. With diabetes, you have an increased risk of damage to the blood vessels over time, including damage to the small blood vessels in the brain. This damage affects the brain's white matter. White matter is the part of the brain where nerves talk to one another. When nerves in the brain are damaged, you can have change in thinking called vascular cognitive impairment or vascular dementia. Vascular cognitive impairment can happen with either type 1 or type 2 diabetes, but there are some differences in risk.
Is there a possible Alzheimer's connection? Research does suggest an association between diabetes and Alzheimer's. People with type 2 diabetes are twice as likely to develop Alzheimer's as people without diabetes. But researchers are still trying to figure out whether diabetes actually causes Alzheimer's. In the pancreas, where insulin is made, there are similar proteins that lead to damage and the death of cells. It is likely to be a shared risk for developing either Alzheimer's or type 2 diabetes because the thing that goes wrong in both of them is very similar.
A new study published this week in the Journal of Neurology shows that people with type 2 diabetes demonstrate a decline in cognitive skills and ability to perform daily activities over the course of only 2 years. Normally, the brain distributes blood as needed to areas of increased neural activity. In diabetic individuals, however, this process becomes impaired. The study shows that people with diabetes have abnormal blood flow regulation in the brain, namely impaired ability to increase blood flow and deliver sugar and oxygen to the brain during episodes of increased mental activity. Inflammation further alerts blood flow regulation in diabetic people and contributes to mental and functional decline.
Here are some of the key findings. After 2 years, the people with diabetes showed greater declines in gray matter of the brain, as well as impairments in their ability to regulate blood flow in the brain than the people without. Blood flow regulation decreased by an average of 65% in the participants with diabetes. Among participants with diabetes, scores on thinking and memory tests decreased by an average of 12%, while test scores of the participants without diabetes stayed the same as 55%. Higher levels of inflammation were correlated with greater difficulties with blood flow regulation. Those with the highest levels of blood flow regulation impairment at the onset of the study had more difficulties performing daily activities such as cooking and bathing after 2 years.
The study is the latest to observe a link between diabetes and cognitive decline, with a growing body of research showing an association between insulin resistance and neurodegeneration. Some scientists are even referring to Alzheimer's disease as type 3 diabetes. Hopefully these findings will one day be used to devise better treatments for the degeneration of thinking and memory skills co-occurring with diabetes. Better detection and monitoring of blood flow regulation could help predict and manage cognitive challenges in people with diabetes. Worse performance on daily activities, worse memory, or slower gait speed in older diabetic adults may hallmark a decline in ability to regulate blood flow in the brain. For older diabetic people, it is important to maintain healthy lifestyles and minimize fluctuations of blood sugar levels in addition to their medication regimen.
Medical intervention. Type 1 must take insulin, and Type 2 takes it if other medications or diet and exercise are not working. Several kinds of insulin are available. Some are slow-acting, and others are for prolonged or intermediate lengths of time. Insulin is injected by insulin pump or use of insulin jet injector. Injections are given in the abdomen, upper arms, thighs, or buttocks, and people vary the injection site to reduce the soreness. Target blood glucose levels are between 70 and 130 milligrams per deciliter before meals and less than 180 milligrams per deciliter 1 to 2 hours after a meal. Medical management includes referral to a dietitian for diet adjustment and education to reduce the intake of sugars and increase dietary fiber. Weight loss improves the control of diabetes symptoms for people who are overweight. Some medical interventions include healthy eating, regular exercise, possible diabetes and medication or insulin therapy, blood sugar monitoring, or low glycemic index foods. Some healthy foods include fruit, vegetables, whole grains, fewer animal products, fewer refined carbohydrates, and fewer sweets. Some physical activity that you could do as a part of your daily routine include walking, swimming, biking, dancing, stretching, strength exercises, and you want to make sure to do 30 minutes at least 5 days a week. Monitoring your blood sugar. Check and record it. Either could be every now and then or multiple times a day if you are on insulin. Diabetes medication and insulin. Metformin is used to improve sensitivity of your body tissues to insulin. It lowers glucose production in the liver. Nausea and diarrhea could be possible side effects. It usually goes away as the body gets used to medicine. Insulin therapy is a normal digestion interferes with insulin taken by mouth. Insulin must be injected. Use a fine needle and syringe or insulin pen injector. May be prescribed low-dose aspirin therapy as well as blood pressure and cholesterol-lowering medication to help prevent heart and blood vessel disease.
Effect on engagement and occupation. Symptoms of diabetes include polyuria, which is excessive urination, polydipsia, which is excessive thirst, and polyphagia, which is increase in appetite. Fatigue, blurred vision, numbness and tingling in the hands or the feet, sores that do not heal, unexplained weight loss in diabetes type 1, and usually obese and an increase in abdominal girth in diabetes type 2. Symptoms of type 1 diabetes can start quickly in a matter of weeks. Symptoms of type 2 diabetes often develop slowly over the course of several years and can be so mild that you might not even notice them. Many people with type 2 diabetes have no symptoms.
OTA intervention. Activities of daily living and instrumental activities of daily living. You can reinforce knowledge of diet restriction while assisting person to plan and prepare healthy meals by encouraging, for example, calorie counting, food exchanges, weighing and measuring, and reading labels of food containers for amounts of glucose and carbohydrates. Education and techniques to structure time and simplify activities to cope with depression, such as breaking down dietary changes and an exercise program into manageable steps and incorporating them into present daily routines. Address safety issues in the kitchen. Provide opportunity to practice self-care activities using energy conservative techniques. Provide opportunity to practice self-care activities using low vision techniques. Promote lifelong adjustments to include glucose monitoring, tracking blood pressure, weight management and dietary restrictions, skin examination and management, and administration of insulin if needed. Promote balance of habits, routines, and occupations. Provide techniques to organize and track medications. At school and work. Assist person to organize work schedule to accommodate glucose testing and self-management into workday. Suggest changes in work environment to increase safety and safe material handling. Play and leisure. Assist person in exploring and selecting leisure activities that are compatible with stage of diabetes and chronic conditions, such as those that do not require fine motor skills or use of sharp tools. Social participation. Promote life role changes to accommodate chronic diseases and its complications. Preventatives. Smoking cessation, foot self-inspection, maintenance of personal health records, and regular eye, foot, and dental exams, creating a need for clients to track and diligently attend appointments with their diabetes healthcare team. Today we're working with a diabetic patient, and we are working to come up with a healthy breakfast for her. We decided to do a piece of whole wheat toast, a handful of grapes, and make a bowl of oatmeal. So first we're going to start off with the oatmeal. So we're going to have her grab the oatmeal, which is easily accessible for her, and then a bowl. She's going to make the oatmeal just like how she does every other time. The microwave is on a low surface for her to reach nice and easy. And then we'll get started on the toast. The toaster is out, nice and easy for her to reach. Okay, then we'll get a paper towel and some grapes. So here's the finished product. We completed all the tasks and made a nice healthy breakfast.
Hi, my name's Megan, and I'm an occupational therapist that will be working with a patient today to help her with medication scheduling. We are going to be helping the patient to set an alarm so that they can take their medications at the same time each day, and so that they won't forget their medications. And we will also be working with the patient to set up a place for them to put their medication in, like a pill box, so that it's easy accessible throughout the week for them. The patient has labeled her pill box for the week, so she knows what days she takes what medication. She will now be placing her medication into the box for each day.
So this one says twice a week. So I'll do on Mondays and Tuesdays. Oops. And then this one is twice a day. This is once a day. And then this is also once a day.
Okay, so what time of day do you think it would be best for you to take your medication?
Probably in the morning right when I wake up.
Okay, so what time do you normally get up in the morning?
Around 7:30.
Okay, so should we set your alarm for 7:35 every morning then maybe? Just remind you to take your medication.
Do that at 7:30 every day. Okay. Cool.
All right. Occupational therapy focuses on lifestyle modification, health promotion, and remediation of physical and visual impairments and maximizing self-care independence, all of which are directly and adversely affected by diabetes and its complications. Occupational therapy practitioners focus on helping clients take charge of their diabetes as opposed to being controlled by it, so they can participate in everyday activities.